Hello friends, welcome you all at Indian Institute of Learning Life Saving Skills. Today we are there again with you with continuing our classes of clinical case scenario discussions which are there and patient present in the emergency and triage and casualty as on and off. So today we'll be discussing more important about the cardiology and neurology. So what is the basic difference and where we must take a wise decision to use and just judicious use of anticoagulants, whether it or it might be antiplatelets, drugs when we are talking about a patient who has presented with accelerated hypertension with chest pain. So where we must demarcate the patient when we must use the things or drugs judiciously and where we must not use the antiplatelets. So here is a case discussion. A 65-year-old female presented in the emergency department with severe chest pain and persisting vomiting with severe headache with vomiting and persisting chest discomfort. On arrival in the emergency department, the ECG was done and ECG was showing non-STEMI. ST elevation depression in the chest lead, AVL and AVF. Okay. Along with these, patient was even having the persisting complaints of severe headache and vomiting. On arrival, the blood pressure was 220 by 110. 220 by 110, patient was running tachycardia, saturation was maintained and patient was slightly drowsy but arousable on that. So these conditions we must be very judicious to use, because neurology and cardiology, the basic difference is in cardiology you can blindly use the antiplatelets. Any person who comes with chest pain, left-sided chest pain with profuse sweating may or may not be present, and along BP normotensive, either slight increase or lower side. In these patients with chest discomfort, you can suspect of ACS, acute coronary syndrome, and we use the drug antiplatelet on these patients. But in cases where neurology is practiced, where you are suspecting of neurological conditions, you are never supposed to use the antiplatelets until and otherwise it is that NCCT head is found to be negative. So these conditions you must be very judicious and you must be very careful before using the antiplatelets where you are suspecting of neurological cause. While evaluating the patient, sometimes we will be more focused on the cardiology, and we will directly use the Disprin, antiplatelet, ecosprin and all. But this case scenario, this example given to you is patient coming with chest pain and on ECG there are changes, and along with that patient is having severe headache, persisting vomiting, and BP is 180 by 120 plus. So these patients we must be very careful while evaluating the patient, and before using the antiplatelets or either Disprin we must be very careful, because there is no reversal for that. Once we have introduced or once the drug has been given, there will be no reversibility in that. So you must be very careful in that. So these patients, when you are suspecting strong neurological etiology, you must ask the patient, or patient has to undergo the NCCT head. And if it comes to be negative, there is a no bleed either of any origin, intracranial or subarachnoid hemorrhage, whatever might be. So before that you are not supposed to use. So this case discussion is about the cardiology and neurology, how it is practiced. Sometimes the things will overlap. There might be the ECG changes, electrocardiographic changes you will find in some of the neurological conditions where there is accelerated hypertension, and when there is accelerated hypertension, patient is running the tachycardia and all tachyarrhythmias. In that, very difficult to find out the acute coronary syndrome. So before using the antiplatelets we must be very cautious, and before using that the patient must undergo the non-contrast CT scan, NCCT head. If it is in-house, hardly it takes a few minutes to find out whether it is a negative, there is a no bleed, and for directly then we can go for the other treatment protocols. So the basic difference between neurology and cardiology, where it is practiced, cardiology we can blindly, rather than using the word blindly, or we are very free hand while using the antiplatelets. But in case of neurology, it makes the difference. And when things overlap each other, then you must be very cautious and you must be very careful while deciding the treatment protocol or while evaluating the patient. So be careful when the patient comes to you with a chest pain, along with that neurological symptoms, neurological complaints, either vomiting, headache, and BP is on higher side. So please do not forget to suspect the intracranial pathology. Either it might be intracranial hemorrhage or either it can be subarachnoid hemorrhage, whatever it might be. So we must be very judicious. So be careful and do consider, if you are dealing more of cardiological emergency in a cardiology department, if you are sitting in emergency, you are a new learner, so you be careful, you must be very careful. Both you need to examine very carefully cardiology and neurology before administering these antiplatelet drugs. So thank you very much for watching this. Keep sharing, keep learning, be in touch with Indian Institute of Learning Life Saving Skills and learn the things. Thank you very much.